Well, globally, Florida has become one of the hardest hit places for coronavirus. Florida's Department of Health is working to quickly bring a COVID-19 vaccine to the state once it becomes available. ABC 27's Jada Williams joins us live from the health department. Jada, how do people feel about getting that vaccine?
Channing, many people I spoke with today say that they're apprehensive about getting that vaccine. Some say that there's just no chance they're going to get it at all, while others are saying that they want to see how it will impact the community and affect others before they decide to get it. Most don't look forward to getting a shot at the doctor, especially when you add in the uncertainty surrounding COVID-19.
It's like when a new iPhone comes out. Everybody go get it, but as soon as you get it, you have issues with it.
Still, the more than 500,000 cases of COVID-19 in the Sunshine State has health leaders searching for relief. The Center for Disease Control now inching into the third phase of vaccine development.
The antibody response is what we might consider sufficient as well as long-standing. Then that would be a candidate vaccine that the evaluation data goes to the FDA. The FDA gives it the stamp of approval, and now it's out there.
The CDC now looking at Florida to hold trial runs for a COVID-19 vaccine. In a statement to ABC 27, the Florida Department of Health says, for COVID-19 vaccinations, we have held an initial interest meeting with CDC to discuss the pilot. There will be a meeting at a later date to discuss the scope and direction of the pilot project. But there's hesitation from people in the community.
They rushing it. Like sometimes when it comes down to vaccine, I heard it can take somewhere between 18 months up to 2 years for them, for them to have a decent vaccine. So you don't want to rush something like that, because you rush it and start having side effects, then that's going to be a problem.
However, FAMU epidemiology professor Perry Brown says the time limits are different for COVID.
With this kind of an infection, which spreads so rapidly, which has such a tremendously high mortality rate, we don't have that luxury.
While community members decide to wait,
I don't know if I'm ready to jump on and getting it before I see how the effects on people is going to be.
Perry Brown says side effects outweigh COVID symptoms.
Minor side effects on balance against getting COVID-19 and having a systemic pernicious infection, I go with side effects.
The Florida Department of Health says that they haven't decided how distribution or even when distribution for vaccines in the state will be. Now, as for other states involved in that pilot program, it's California, Minnesota, and North Dakota. Reporting live from the Florida Department of Health, Jada Williams, ABC 27.